you for coming. It's 11 o'clock, so I think we'll get started. Very first, will you please silence your cell phones? Either turn them off or silence so that they don't beep. I'd like to introduce Joe Micucci, who's going to tell us about family systems, theory, and therapy. So with that, I'll turn it over to Joe.
Am I on now? Okay. Thanks, you all, for coming. Thank you for being here. So I thought this would be of interest to people because, everyone, at least at one point in time, has been part of a family. And maybe even some of you have participated in family therapy. I thought perhaps this would be an interesting presentation. As for me, I was really introduced to family therapy back in 1984, where I was fortunate enough to be hired by the Philadelphia Child Guidance Clinic, which at that time was an international center for family therapy. I was hired. I didn't know much about family therapy at the time. I mean, I got a little bit in graduate school, but that was pretty much it. And I was hired to do psychological testing, which I knew a fair amount about. So I've considered this a nice foot in the door because I had heard about the Philadelphia Child Guidance Clinic. I actually had a friend who I was in Minneapolis in graduate school, and I had a friend who had come out over the summer to Philadelphia to take a summer course and came back and just was full of all kinds of great ideas. So I felt really fortunate to be able to go there. And while I was doing my testing job, I was able to get trained by really, really great people. And the Philadelphia Child Guidance Clinic was a very unique place. I worked on the inpatient unit, where back then insurance was a little more generous and was allowing the kids to stay for 30 days and sometimes even a little longer. I worked on the adolescent unit, and we had 2 apartments in the hospital where the entire family could move in for 30 days. It was an incredible place. I mean, the ideas were just banging around. People were trying really creative stuff. And I felt I got really, really great training there. So I've been working with families now for a long, long time. And I thought it would be interesting to kind of share a little bit about what we some concepts that we can use to try to understand families. So my plan is today I'm going to focus mainly on more kind of theoretical ideas. I'm going to try to keep the jargon to a minimum, okay? I promise, or at least the jargon that I'm going to use is on that paper. So I'm going to try to keep the jargon to the minimum. And then next week, hopefully you'll all come back and I will talk about actually what we, or at least I do in family therapy, how we actually use these concepts to work with families. Now let me say a few things. First of all, we're going to talk about systems theory. And of course, systems theory has wide applicability. Workplaces, political, economic systems. I'm going to be focusing specifically on its application to families. And to keep things simple, and I thought a lot about, well, how do I want to present this? I mean, I could go on for probably 6-7 hours talking about this stuff. So how am I going to try to keep this simple and digestible? I'm going to be focusing primarily on the 2-parent nuclear family, keeping in mind that the principles can be applied to alternative family forms, divorce, remarried, blended, single-parent families. And also, there are theories that address the functioning of multi-generational systems. These perhaps might be a topic for another class sometime down the line. But to try to keep things simple and digestible, I'm going to be focusing primarily on the 2-parent nuclear family. Okay, so in the 1950s, there was a lot of interest in looking at families, primarily stimulated by the interest in the severe mental illness schizophrenia, which back at that time, there weren't really a lot of treatments available. We didn't have the medications available that we have today. Some of the therapeutic techniques that were being used weren't always effective, and people started to wonder, well, maybe we should be meeting with the whole family to see what we can learn about the families of people with a severe mental illness. And also, these researchers felt that there was too much emphasis being placed on the problem of the mother. You know, back there, the idea was that, you know, there was the schizophrenogenic mother. The mother was the primary cause of the problem. And they thought, no, you know, let's consider something a little broader. So they began to meet with whole families and studying them, basically. They weren't really trying to treat them at the time. They were just trying to do research. And then they started to look around for theoretical models to help describe their observations of it. What were they seeing? And they found them in two conceptual frameworks that were beginning to come to prominence in the 1950s, general system theory and cybernetics. Now, general system theory was, the originator was Lugo von Bertalanffy, and he was actually a biologist. And back in the 1920s, he had originally proposed the concept known as organismic biology, emphasizing the importance of studying biological systems as organized wholes. Uh-oh, okay. Now I made a mistake because I didn't, here I go. There we go. All right, I got it. Okay, so this idea evolved into general systems theory, which applies to all organized entities, not just biological systems. So I guess we should define what a system is. And a system is a set of elements that interact in predictable, repetitive ways that together make up a whole arrangement or organization. So using that definition, there are both non-living and living systems. General systems theory applies to any organization that fits the definition of a system, not just biological systems. Now, one of the key principles, and you've probably heard this one of the key principles of general systems theory is that the whole is greater than the sum of its parts. Now, everyone has probably experienced this. If you ever tried to take something apart and then you had to put it back together again, right? You were, well, wait a minute. I don't just throw them all in a bag and, you know, shake it up and then there it is. They go together in a particular way, right? So that's what is meant by the whole is greater than the sum of its parts. The whole clock, right, is not just an assemblage of all of these different parts of the clock, but it's the parts plus the relationship among the parts, the specific way the parts are organized. So all parts of a system are connected, and what affects one part is going to affect the other parts. And of course, you've probably seen this too, the kind of classic image for this is the mobile, where you just kind of pull on one piece of the mobile and everything moves. Now, the other conceptual model embraced by the early family researchers was cybernetics, which was first proposed by Norbert Wiener. And cybernetics intended to explain how the parts of a system communicate with one another and how the system regulates itself. And of course, cybernetics has been very influential in the development of computers and artificial intelligence. According to cybernetics, systems self-regulate via feedback among the parts of the system. And for example, the endocrine system in the body, right? The levels of hormones in the body are regulated by a feedback system. So here's a kind of a gallery of some of the early family therapy researchers, Gregory Bateson, Virginia Satir, Jay Haley, Paul Václavic, Don Jackson, Mary Bowen, and of course there were others, but there were really only room for 6 on the slide. Um, Early pioneers found these ideas very useful in helping them understand what they were observing when they were meeting with whole families. And they used these ideas to develop theoretical models of family functioning and ways to work therapeutically with families. The common element was a shift from considering an individual person in isolation and looking instead at the individual in context, particularly the interpersonal context, the context that was made up of other people. So they paid attention to patterns of interaction among members of the family, and certain patterns tended to recur over and over. So if we think about 2 people who are in relationship, A and B, okay, A's behavior, they noticed, didn't really cause B's behavior in the same way that, let's say, a billiard ball striking another billiard ball causes the second one to move. That doesn't quite work that way. Instead, A and B were in ongoing interaction with one another, such that B is responding to A, who in turn responds to B, who in turn responds to A, and so forth. And they called this circular causality. To distinguish it from the kind of predictable linear causality that occurs when one of the participants is inanimate. So, for example, 2 billiard balls or a person throwing a ball, right? A person throws a ball, the ball doesn't respond to the person, the ball just goes, right? A person kicking a rock, the rock doesn't kick back. The rock moves or maybe doesn't move, but anyway, there's a response from the rock, okay? So when we're dealing with 2 people, because the association between A and B is circular, back and forth, both were playing a role in the interactional pattern that emerged. People who are in ongoing interaction with one another, for example, people in couples and people in families, are mutually influencing one another and shaping each other's behavior over time. So for most ordinary interactions, identifying one person's actions as the cause of someone else's is giving only part of the story. Doing so is known as a punctuation of the sequence. Okay. Punctuation means attempting to identify a single cause or blame in a circular interaction. In fact, families can get stuck in problems and unproductive patterns because they are stuck in a particular punctuation. And this punctuation that involves blaming or attributing the problem to one of the actors. So for example, a child's misbehavior is seen as the cause of disruption to the family, right? Or a child is misbehaving because the mother isn't dispensing appropriate discipline. Okay? No one is entirely to blame, or all are to blame, but it's actually better to dispense with the notion of blaming at all and consider how they are all linked together and influencing each other, how they are all playing a part in the problem. Now, there are 2 types of circular patterns. One is called complementary, and this is when the 2 participants adopt opposite positions. And of course, sometimes this is great. You know, we all know couples, or perhaps you're a member, have been or are a member of a couple where there's a nice complementarity between the 2 members of the couple. You know, one is more sociable, the other's more reserved. One is more creative, the other is more analytical, right? But sometimes complementary patterns are not necessarily helpful. For example, an attack-defend pattern. One person raises a concern about the other person who feels attacked and responds defensively, which leads the first person to feel like, you're not listening to me, right? So they restate their concern, or usually restates it more forcefully, which leads to a more forceful defense, and they're just kind of off and running in a cycle of complementarity. Pursuit or withdraw. One person seeks more closeness, the other person doesn't, so they pull away, of course, which leads the first person to push for more closeness, and it just keeps going. Underfunctioning and overfunctioning. One person is impaired in some way, and the other person compensates by doing more or protecting the first person from the consequences of underfunctioning. And of course, that just keeps going back and forth. Right. The other pattern is known as symmetrical. Symmetrical is when the two participants match each other's behaviors. So an example, of course, would be arguing, right? Or ignoring differences or disagreements, or commiserating, just kind of complaining, mutual complaining, right? The problem with symmetrical interactions is that it will just continue to go and grow and grow and grow and escalate unless something happens to break the pattern. So what could happen? Well, one thing that could happen is that the couple breaks up, right? They separate. That'll break the pattern, maybe or maybe not, but at least in the immediate. Someone withdraws from the interaction, someone storms out of the house and slams the door. Okay, well, no more arguing, the person's gone. Okay. Or, and this is perhaps a better way of handling it, is to adopt a complementary position. So instead of arguing with the other person, saying something like, I'd like to try to understand what you're saying. Right. Now, sometimes family members can get caught up in vicious cycles where there are patterns of mutual reactivity that are self-sustaining. So let me give you an example of this, which is, this isn't an actual specific case that I've seen, but I've seen many cases like this in the course of my work. So let's say that a mother calls a therapist requesting sessions for her son, who she believes needs help. The kid is non-compliant, argumentative, and disrespectful. And the mom thinks the kid might be depressed, and she wants to give the kid a chance to open up to someone other than his parents. So the kid reluctantly agrees to come to talk with the therapist. Okay, the therapist sees the kid alone without the parents. Okay, now often kids like this will behave similarly with the therapist. Okay, who's basically just seen as another adult authority figure. So they're going to be resistant, argumentative, non-cooperative, and the therapist says, aha, this kid is definitely a problem. In fact, he has a diagnosis, oppositional defiant disorder, and we're going to need to treat him and maybe even think of some medications. Let's say, though, that the therapist asks the parents to come in with the kid. Uh-huh. And the father is very angry, yells at the kid, threatens him, and they get into heated arguments. So we're tempted to say, aha, now the father's the problem. He has an impulse control disorder. That's why this kid is acting the way he's acting. Well, what about mom? Mom is very anxious. She's worried that a fight could break out between the two men in her life. She tries to appease the kid. She tries to reason with the father. And we think, maybe this mom has an anxiety disorder. Well, actually, a family therapist would say, you know what, they're really all part of a problem and they're stuck in a cycle. The more the kid rebels, the angrier the father gets, the more they argue, the more the mom is anxious, gets in the middle of their arguments. She tries to appease the kid, but he interprets her as supporting him against his father. who he sees as controlling and hostile towards him. Meanwhile, the father feels undermined by the mother, and this makes him even more angry. So the problem is not limited to one person. They are all involved in a kind of dance that keeps them stuck. So, just to summarize up to this point, a systems approach focuses on seeing problems in context. How problems are linked to interactions among family members, and a shift away from trying to find out what initially caused the problem in the past to what is maintaining the problem in the present. So rather than asking, well, what factors in the past caused this problem to arise? The question becomes, what is going on between and among the family members to keep this problem active? How are their interactions maintaining the problem? And of course, they don't realize this. You know, they're often without realizing that they're doing this. Right? Any questions yet? Okay. Okay, now several models of family therapy have been developed over the years, and they all share common concepts from systems theory, but they emphasize different aspects of family functioning. This is probably a bit of an exaggeration, but there may be as many ways of doing family therapy as there are family therapists. That's probably an exaggeration, but the point is that there are many, many different models of working with families. For example, some models focus on patterns in multi-generational extended families and how they impact an individual's functioning. And as I said, you know, perhaps another class on that down the road. But a model that has been very influential in my own work, because it was the model that was used at the Philadelphia Child Guidance Clinic, is called structural family therapy. And this was developed by Salvador Minuchin, who led the Philadelphia Child Guidance Clinic back in the 1970s. Now, by the time I got there, he had left and moved on to other activities. But I was trained by the people who were trained by him. So I kind of like to think of myself as Minuchin's professional grandchild. Okay, by family structure, we mean how a family system is organized. So Minuchin developed a set of concepts to describe family structure. Okay. Also, he proposed what type of organization tends to be more or less effective. And the presence of a problem within the family signals a problem with the structure. So those were kind of the basic ideas underlying structural family therapy. Now, well-functioning systems must maintain a balance between stability and change. Obviously, stability is necessary in order to remain a family, right? I mean, without it, there could be fragmentation or dissolution or the loss of identity as a family. Okay, so the push towards maintaining stability is known as homeostasis. You don't need to necessarily know that term, but I just wanted to mention it because it's used fairly often. On the other hand, change is necessary because the environment changes or time is passing. For example, there's increased stress on one of the family members because of work responsibilities or illness. Okay? Children are getting older and they want more independence. Or the youngest child leaves the family home and the parents are in the empty nest situation, as many of you may have experienced. The family needs to have enough flexibility to adapt to these changes. If not, problems can develop. And often we see problems arising in families when they are facing a change in circumstances, but they are trying to hold on to patterns that worked for them in the past. But these patterns are not going to work for them any longer because their situation has changed. Some kind of a adaptation is necessary. And according to Micucci, what needs to change is the structure of the family. The structure of the family must change in order for the family to be able to flexibly adapt to changing circumstances. And what frequently happens is that the families who wind up coming into therapy with problems they're not able to solve on their own are unable to make that structural change so that they can adapt to their new circumstances. Okay, so trying to keep it simple, I've kind of reduced the ideas of structural family therapy to 4 basic concepts, or maybe 4.5, because the first one is really kind of 2 of them. Subsystems and boundaries, hierarchy, alignments, and triangles. So I'm going to talk about each of these right now. But before I move on, let me see if there are any other questions at this point.
Maybe premature, but surely you're familiar with that book by Salvador Micucci, Psychosomatic Families. And the book seems to encourage your approach, examining the family structure in the context of anorexia. And I'm wondering, in retrospect and over the years, has the premise of the book, that is that examining and realigning and deconstructing the family structure tend to cure anorexia? Because from what I recall, the premise of the book came under some attack after a while.
You know, like many books, I think the argument is somewhat overstated in psychosomatic families. But the structural model was very, very influential in the development of the Maudsley model for treating anorexia, which is a family-based model, which really borrows a lot from the structural family therapy. I think what has probably changed is that there is a little more attention being given to the individual adolescent and what their particular needs are, in addition to working with the family structure to help the family to learn ways to help the kid and what kind of assistance and what kind of limits they need to put on the kid. I should say, personally, when I was at the Philadelphia Child Guidance Clinic, we worked with a number of anorectic kids, and they improved significantly in the course of the hospitalization. There was one case that I worked with pretty intensively who I would say the anorexia was essentially cured because she gained weight, reached a normal weight, and was able to continue on with her life. Not simply during the hospitalization, though. It was about a year or 2 follow-up that I treated this case. So there's another question over here.
What happens if one person leaves the family structure?
Well, that changes the structure right there. If one person leaves the family, that changes the family structure.
Could you say more about that, please?
Well, you mean like a parent or a kid, or a parent leaves? Yeah. Well, now a 2-parent family becomes a single-parent family, And well, it depends on how the person leaves. If the person passes away or if there is a divorce or a separation, there's different ways of considering what needs to be done or what needs to be addressed to help the remaining people in the family to make that adjustment. So as I said, I'm trying to focus simply on the two-parent family, and how do we work with those other family forms is a little more complex, and perhaps that would be another class sometime. Yeah. Okay, so I'm going to talk about each of these now. Okay, subsystems and boundaries. Now, subsystems are defined by their function within the family. And normally we talk about, or at least Micucci talked about, three subsystems that are important. There's the parental subsystem, whose job is to take care of and guide the children. Okay. The spousal subsystem, realizing this is not the case in all families. Okay. The spousal subsystem's function is mutual support and nurturance between the spouses. Now, of course, if there is a single parent family, I will kind of shift a little bit into that. If there's a single parent family, we don't have a spousal subsystem, right? We have a parental subsystem, but that single parent still has their own personal needs which need to be attended to. So perhaps we can call it the parental support subsystem, okay? And the sibling subsystem, of course, there's a single child in the family. We don't have a sibling subsystem, but the function is still necessary, okay? The function of the sibling subsystem is socialization, learning how to get along with peers, learning how to share, right? So if it's a single child in the family, that's going to have to come somewhere else, from cousins or other kids in the, in the neighborhood, perhaps, okay? Subsystems function best when there are clear but flexible boundaries around the subsystem. Boundary, I mean, everyone knows what a boundary is, but basically a boundary in structural family therapy is defined as who has contact with whom about what. But I think everyone has a kind of intuitive idea what a boundary is. So, okay, what happened? Oh, yeah, go back here. Oh, I'm going backwards, sorry. There we go. Okay, so problems arise when boundaries are unclear, weak, or too rigid. So here are just examples of possible problems with boundaries. Parents don't consult with one another. So that would suggest there's an overly rigid boundary between the parents. They don't consult with one another. Or one family member speaks for another person as if they know what the other person is thinking. So that's kind of called mind reading. Or a parent shares their own problems with a young child. That's certainly a boundary problem. I think we would all agree that that is not appropriate. Okay. Now, Micucci also defined two concepts that can apply either to the entire family or to dyads, two people. A dyad is two people in the family. And these two concepts are enmeshment and disengagement. Now, in enmeshment, two individuals or subsystems are too involved with each other. So we would say there's weak boundaries. There's pressure to think, feel, and act in accordance with the other's wishes. Since two people in the family might be in an enmeshed relationship, well, that gives them less time, attention, energy to share with other family members. So other relationships within the family might be neglected. If the whole family is enmeshed, as we do see in some cases, then outside relationships might be neglected. Examples of enmeshment would be mind reading, right? If I meet with a family and I see one, let's say a parent says, well, this is what she's thinking. Right? Well, you don't know that, but to me, that's a sign that there may be some enmeshment going on. Bickering without problem resolution. A lot of people would say, wait a minute, these people are bickering all the time. They can't possibly be enmeshed. Oh, no, they're definitely enmeshed. They spend all their time bickering, and they never reach a solution anywhere. All right. The other pattern is known as disengagement. In disengagement, two individuals or subsystems are insufficiently involved with one another. So this is a case of rigid boundaries. So what are some signs of disengagement? Over-involvement in external activities. For example, work or social relationships outside the family. Another sign is unavailability to other family members. Secrecy or lack of curiosity about the other people in the family. And the problem with disengagement is that problems are not noticed until they become really severe. Okay. Now, this is a dimension, and certainly culturally, some families fit more on the disengagement side, and some families fit more on the enmeshed side.
Especially in this section, I've been thinking, it really made me think about cultural differences among families, and how for some kinds of families, more, I mean, an Irish family is not the same as an Italian family.
Yeah.
Yeah,
exactly.
So what might be normal in
Yeah.
one is not normal in another.
Right. Certainly I would say having grown up in an Italian-American family, our family was leaning more on the enmeshed side. Okay. But that wasn't necessarily a bad thing. We're talking about extremes, right? Because we were also able to participate in activities outside the family and have friends and, but in terms of how the family operated, it was kind of more towards the enmeshed end. So this is not necessarily, oh, it's a problem. Everyone's got to be right in the middle, because it's not going to work that way. Yeah. Okay, the other element of family structure is called hierarchy. Hierarchy is about how are decisions made in the family. Now, Micucci said, ideally, the parents should be guiding the family. The adults should be guiding the family. They should be setting expectations for the children, and they should also be providing support and nurturance for the children. Now, possible problems might arise with, and these are just examples, possible problems that might arise with hierarchy. Parents do not have or do not exercise their authority. Inconsistent or unrealistic expectations of the children. Children's feelings and preferences are not considered in decision making. That doesn't mean the kid makes the decision, but it does mean, well, how does your kid feel about this? Right. Parents are providing insufficient support for the children, insufficient emotional support. Right? Or someone is undermining the parents. Hopefully this doesn't apply to anyone in this room, where but sometimes grandparents might be undermining the parents rather than supporting the parents. Right? Alignments are the next concept. And alignment is an emotional or psychological connection that family members make with one another. So when I meet with a family, one of the ways I try to assess what are the alignments in this family, the questions are, well, who agrees with whom? Who is supporting whom? Okay. Now, I don't want to imply that an alignment is a bad thing. It's not. There have to be alignments in the family, but we need to know what they are, because sometimes, as I'm going to cover in a second, there are problems with the alignments. So ideally, what we want to see is that the parents are aligned in guiding and supporting the children. Okay, that's a good alignment. Okay, but we might have some problems with that. The parents might be undermining one another. They don't work together as a parenting team. One person says one thing, the other parent says something else. Okay, and this could even be very, very subtle that we see when we're meeting with families. And right now, I'm not treating families. I've retired from my own practice, but I do some supervision with the doctoral students at Chestnut Hill College. So I do get to see this vicariously. One of the things that we frequently see when there's a kind of unruly kid in the session is one parent might say something like, okay, could you please come sit here right next to me? And the kid doesn't do it. And instead of saying to the kid, your mom said, go and sit next to her, the other parent might say, well, why don't you just go over there and color? See, thinking they're helping, but not really. Okay. A cross-generational coalition. Now, this is something that's really problematic. This is when a child is aligned with one parent against the other parent. Okay, there's nothing wrong with one parent maybe being a little closer to one of the kids than the other kids. That's not what we're talking about here. What we're talking about is that the parent and the kid is aligned against the other parent. That's a cross-generational coalition. Or, and hopefully this is not applying to anyone in this room, a grandparent is aligned with the child against the parent. The key for the cross-generational coalition is the word against, okay? Triangles, okay? Triangle is when closeness and distance between two individuals are regulated by a third person, okay? For example, two people are united via their common concern or an enmity for a third person. Okay, so in other words, they are united because they are both really, really concerned about a third person, or they're united because they both can't stand a third person. Okay, right. Now, honestly, I mean, and certainly another family therapist, Murray Bowen, would say this and say, look, triangles are inevitable. I mean, there are going to be triangles in life. We really can't get away from them. All we can do is recognize them when they're there and assess whether they are being destructive, okay? So for example, you know, friends who are gossiping. Look, people gossip. Friends who are gossiping about another person, or did you hear so-and-so did this and that? That is not necessarily destructive. It happens all the time. But sometimes triangles can be really problematic. For example, conflict between the parents is detoured through a problem child. And this is scapegoating, okay? Where instead of the parents kind of recognizing that maybe there are some issues that the two of them have to be working out, okay? They are focused on this bad kid, right? A cross-generational coalition. A cross-generational coalition is what I mentioned a little earlier, right? That's an example of a triangle because we have two people against a third. Okay, okay. So this is not a real family. These are students who are in a role play. This is just a picture. Okay, now that I've described the theoretical concepts, I want to, in the next class, actually, I'm going to talk about how structural family therapists actually work to help families and give you some examples about some of the techniques that we might use to help families. Well, let me stop there and take questions if there are any. There is one in the back.
Thanks, Joe. I was a social worker at Children's Hospital from 1990 to 1996. in the newly created home care department.
Mm-hmm.
So almost all the families I worked with had an ill child,
Mm-hmm.
pretty, sometimes very seriously ill,
Mm-hmm.
or certainly chronically ill, and they were being treated at home some of the time. And of course, that's quite a stress on the family.
Mm-hmm.
But anyway, one of the things that I thought Minuchin implied was that the family needed somebody in the family to be sick.
Mm-hmm.
And how offensive that is,
Mm-hmm.
and really hurtful to these families. Did he ever change that belief?
Actually, I'm not sure he was not actually the person who originated that idea. That came years before him. It was Don Jackson who proposed that the family needed a symptomatic or sick member in order to maintain their homeostasis. Now, I think that Minuchin modified that idea. And certainly later in his development, I think that idea really kind of faded more into the background. And the idea being that it wasn't so much that the child or this quote unquote sick person was sick, but is the child who is sick or has a diagnosis, they is their functioning in any way being compromised? In other words, is it possible that they could be doing more if the family members were reorganized in a particular way? So it was the concept was moderated, and I think that concept that the sickness was a necessary part of a family was one that I think was a very, very old idea that most of the more modern thinkers don't fully embrace. They do consider the possibility, though, that in some families, when one person gets better, right, another person has a problem. Okay, and that's an issue that needs to be addressed, because what that says is that, well, maybe that person got better, but the family never really reorganized. So now this other person winds up becoming symptomatic. So a concept, a slide that I actually took out because I thought, I don't want to like overwhelm you with concepts, but there's this notion of first order change and second order change. Okay. First order change is when someone changes in the family, but the family structure and organization doesn't change. Second order change is when there is a change in the family structure. Okay. So for example, one person goes to individual therapy and they improve, and then they come back to the family and they maintain their improvement, but somebody else develops a problem. See, so I'm going maybe on a tangent from your question, but the question is no. If that's a message that was being given to these families from the family therapist, I think they perhaps misunderstood where, yeah, or yeah, well, one that wasn't adequately trained, perhaps, yeah.
Thank you. Could you just clarify for me a little confusion I had coming in today? There's something called the internal family systems model.
Yes.
That is not what you're talking about today.
No, that's a completely different model.
Is there any relation between those two things? Or?
Well, Richard Schwartz, who originally developed the internal family systems model, was originally a structural family therapist. Yeah. So it's something that's been used a fair amount with trauma, and I think many people have found it very helpful. And but it's a model that works more directly with one person and the kind of different parts of their personality that kind of represent, in some cases, different family members, or in some cases represent different ideas that they may have adopted. So there's these, and that they're kind of working across purposes and then working to kind of try to integrate them into one.
Thank you.
whole.
Wondering what has been the response of the psychiatric community who depend on treatment of conditions that might arise in the course of family therapy with the use of psychotropic drugs.
Oh, it's integrated. I mean, the use of psychotropic medications are definitely integrated. Micucci was a psychiatrist. Some of the people who trained me were psychiatrists. And the question was not, oh, we're not going to use drugs here. We're not going to use medications here, but rather, how is the medication going to become part of this holistic treatment? Yeah. And one of the main things that we would, when medications are used, that we really try to avoid is that when change is happening, that it's not attributed only to the medication, that there is an understanding that something else has changed here as well. Philip.
Joe, I was thinking both Peggy and Jerry's question highlight what I've found as a therapist over the years. I often use the term toolbox, that these theories are always helpful to some degree, and yet I think a good therapist knows how to use them without saying this is the only answer to the problem.
Right.
And also, and you've alluded to this too, and maybe the internal family systems theory gets to it. Each individual in the family has their own history, their own families, and I'd say their own personality styles.
Mm-hmm.
So it isn't just they're working as a system. They bring into their dynamics their generational issues, their own parental relationships, and their own, I would say as a psychoanalyst, also their unconscious repetitions of things. Many of the family therapists were psychoanalysts, and they reacted to, I think, an overly rigid psychoanalytic idea that it was always just the individual or it was the Oedipus complex. So these theories are always great as tools, but we do sometimes in mental health get into this business of warring theories, but I think it does point to the need to hold these as tools. Yeah.
I agree with that. And I think in the early days, as you said, there was very much an us-them kind of a mentality. Okay, well, those psychoanalysts, they don't really know what they're doing. We have the answers here. And of course, that is no longer the case. I think that, as I said, and I think it was perhaps an overstatement, there are probably as many different therapists, ways of working as there are therapists. The people who I think tend to be a little more doctrinaire are the people who are invested in training in a particular model, right? Or students who are learning a particular model, okay? So I think they tend to perhaps be a little more doctrinaire, which is part of their development rather than a problem per se. Barbara.
One thing that I think was not mentioned was the concept of power, and that a lot of behaviors have a certain amount of power in a family system. Like, for example, the triangle. The person who's going back and forth between the two adults. The person that's going back and forth between two adults has a lot of power. Yeah. The alcoholic has a lot of power. Right. The father who abandoned the family has a lot of power. He might not be there anymore physically, but everyone is changed because he's gone.
Yeah. I had, there's another slide that I left out. You may have noticed that I said in most interactions, right, there is a kind of back and forth going on. But in where there is severe imbalance in power, for example, domestic violence, okay, we are not talking about the person who is being abused is creating or helping to enable the abuser. Okay, so we have to be mindful of power differentials. At the same time, people can give away power to other people that actually that other person does not necessarily need to hold on to. So we have to be mindful of that. Certainly the parents clearly have more power than the kids. most of the time, but I've seen plenty of families with adolescents who are running the family, right? Now, you can't say that kid existentially has power. The kid has power because it has been given to them. So we have to be mindful of both, power by virtue of one's kind of social and gender and whatever, but also power that is being given away that could be reclaimed.
One other interesting thing that research has shown is that the role that we have in our family is often played out in work situations.
Mhm.
So that if you're the youngest child in the family and you don't have a lot of responsibility,
Mhm.
you might do the same thing at work.
Mhm.
Or the child who has the most power in the family
Right.
becomes the leader at work or tries to boss other people around.
Mm-hmm. Mm-hmm. True. Mm-hmm. Other questions?
Thank you. I'm wondering if the Renfrew Center grew out of the Child Guidance Center and what the relationship between them was at the same time of the period that you're talking.
I don't know if they grew out of the Philadelphia Child Guidance Center, but the Renfrew Center is, for those of you who don't know, worked with eating disorders and over the years kind of expanded their focus. But we would frequently we would refer to the Renfrew Center if we felt that a kid or another family member needed more treatment. And there was a lot of family work that went on there. But I don't know historically if it evolved. I don't know. I don't know that. Yep. Yeah. Mm-hmm. Okay, it's lunchtime.
Thank you.
Thank you.
Thank you.
So I hope you'll come back next week and hear about how we actually work with these families. Okay. Okay. Right.